So how does Protera Health differ from most digital solutions when it comes to the member experience? So in a traditional digital MSK solution, the member will start the program and undergo a 10 to 15 minute phone call or virtual session with a physical therapist, and they will get set up with a care program. Low back pain, neck pain, shoulder pain. And it's an automated program that the patient will progress through, or the member will progress through, and hit certain milestones on the home exercise program. And then after a certain number of logins or sessions, the digital solution will then get their payment. This is very different from Protera Health. In the Protera Health program, this is a year-long program that is specifically designed to change behavior and improve pain coping and symptom management. So the way we do this is through a very proactive and one-to-one approach with each member we take care of. So when the member signs up, they first get an orientation session where they learn about our program, to make sure that they are right for the program, that they're interested in virtual care, and that they can complete the program. That first orientation is by our care team, and then they get scheduled for their first visit. This is where things get different. Their first visit is actually with an orthopedic practitioner. This could be an orthopedic surgeon, could be a primary care sports medicine physician, or a nurse practitioner or PA that's experienced in musculoskeletal care. During this visit, they will undergo a 20 to 30 minute evaluation, live, digital, synchronous, one-to-one, in which we will assess the patient's condition, understand the history, and then proceed to go forward with the program if appropriate. We'll make sure there's no red flag signs that need an escalation to an in-person specialist as well. After that, the Protera member will then undergo a 1 hour, one-to-one supervised digital session with a doctor of physical therapy. It is a formal session like you would get in the outpatient office, and that includes an evaluation and a treatment. Now, people ask, do you do motion capture? Well, we don't really need it because we're watching the patient. We're not relying on an AI program. We're actually watching the patient go through the exercises, and we're understanding his or her condition at a fundamental level and in a clinical perspective. After that 1 hour encounter, the patient will then get regularly scheduled physical therapy sessions, supervised one-to-one digital sessions every 1 to 2 weeks throughout the duration of the 3-month program. On top of this care from the physicians, the medical directors, and the physical therapists, that health plan member will also receive health coaching to work on nutrition, diet, pain coping, stress management, as well as counseling from a registered dietitian when needed. Throughout the 3-month journey, they're also getting weekly educational videos that are individualized to their condition and their health outcome scores, which we collect throughout the program in the beginning, middle, and end. This can touch upon mental health topics, pain coping, pain modulation, symptom management, about their individual disease state, and about how to think about common treatments such as injections, imaging modalities, medications, to make sure that they're doing the right treatments for their condition. So this is a 3-month journey, and then after the 3-month period is done and the patient has graduated, we will continue to engage that patient for the full year afterwards with regular educational sessions, webinars, health coach check-ins, and at any point, if that patient wants to come back in the journey for a reevaluation or to get some more education or more treatment, we will do so and provide that at no extra cost to the health plan. So this is a very different program than you will see in a traditional digital solution. And from the perspective of an orthopedic surgeon, this is a more robust program than I can offer in my own office because of the multidisciplinary and education and engagement focus, along with the very high accountability and compliance with physical therapy.